Okay, hi everyone. Welcome to Chronic Fatigue, Pain Syndromes, Clinical Strategies and Treatment Application. This is going to be one of the most important seminars that I think I can organize as an educator for healthcare professionals. One of the things that you really want to understand is there's a reason why fatigue and pain are some of the most common symptoms patients come into practitioner's office with. And the key thing is that we have practitioners that really aren't going deep enough to figure out what's happening. So what's basically happening is you have practitioners that have their own bias. They immediately see a patient has fatigue and go, oh, that's got to be adrenal fatigue. Oh, that's got to be leaky gut, or it's got to be something that they like to treat. It's not necessarily a very deep dive into all the different clinical mechanisms. When you're really looking at fatigue patterns, you really have to go all the way down to all the things that impact ATP production. So all the things that fuel the mitochondria, all the things that impact mitochondrial biogenesis, mitochondrial fusion, mitochondrial fission, mitophagy, all these different interactions that take place that really allow us to have ATP. Those things are going to be very important to go through as we go through the course. And then what we're going to do is we're going to go into the clinical applications. How do those things apply to how we see a patient? What kind of labs do they impact? What kind of labs do we need to run? And then from there, once we go over part one, which is primarily focused on fatigue, the last part of part one, I'm going to show you the connections and research between how fatigue leads to pain syndromes associated with the bioenergetics, energy metabolism. Then we're going to go through into a deep dive of pain. And from pain, we have pain syndromes where someone's never recovered from an injury. We have pain syndromes where there is no injury anymore, like a phantom pain, and they still feel pain, central sensitized pain. And then we'll get into things like complex regional pain syndrome and fibromyalgia and chronic fatigue, myalgic encephalitis, chronic fatigue syndrome. And that'll be the gist of where we want to go. So for this first part, what I want to really start with is just going through a review of energetics, cellular and physiological bioenergetics. So the goal of this first presentation is to understand mitochondrial function and bioenergetics. Bioenergetics is not energy medicine. Bioenergetics is the biology of making energy, right? So how do we use fuel from what we eat to actually make ATP energy? So that whole field from when you ingest food to it forming into ATP is called bioenergetics. And then understand how hormones, the microbiome, metabolic pathways impact the mitochondria, and then understand the role of mitochondria beyond energy production as a source of cellular signaling. If you took high school biochemistry, you've learned that the mitochondria is the powerhouse of the cell. Yes, it's much more than that. And what they've really found is the mitochondria really impacts immune signaling function, the stress response, and mitochondria are also involved with synthesizing hormones. So when you have people that have decreased mitochondrial biogenesis, they're not making as much mitochondria, it's going to be a whole host of health problems that are going to come along with it. So we're going to review those concepts and review some research papers related to the pathophysiology and the function of bioenergetics. And then obviously the ultimate goal for everything we teach is to make it clinical. So then we'll go into understanding the mechanisms of fatigue and how they determine the severity of fatigue syndromes in this talk. So let's go into a basic question. What is the key underlying mechanism of inability to recover from chronic disease? So for most of us that are practicing alternative healthcare, we're seeing patients that have walked into the conventional system and they really didn't get what they needed. So they're just desperate. They're looking for help. They have a chronic condition. They're not getting better. So we're constantly faced with the population of patients that just aren't recovering. They don't know what's happening with them. It could be a person that's just constantly exhausted and tired, but they can't really find any disease to explain it. It could be a patient who had something happen to them, but they've never been able to recover, something like a traumatic brain injury or maybe some type of physical accident, like a car accident or things of that nature. Or we could just have a person that's just slowly getting more tired, more fatigued, more depressed, suffering from more pain, different types of pain syndromes. And they think it's aging, but it's not just aging. There's things that are actually happening and they know that and they want to figure out what to do about it. So when we ask this question, like what is the key underlying mechanism of inability to recover from chronic disease? It's basically the ability to regain homeostasis. So homeostasis being the physiological mechanism of balancing things out. So we have all these feed-forward feedback loops that all integrate and work together to always get us back into balance. And when you look at homeostasis, whether it's the neuroendocrine immune system working together, or you can even go deeper, all these different biological, biochemical pathways that are involved with our physiological processes, where you go deeper, all of its different biochemical processes all depend on one thing. They all depend on ATP. So it's impossible for a person to recover. It's impossible for a person to heal. It's impossible for a person to stay healthy when they're not able to make energy. So these pathways all need ATP to function, right? So ATP being our primary source of fuel. So that's one of the key things to remember, that when you're seeing a patient that ultimately says, I'm chronic and I don't know why I'm not recovering, you have to immediately realize one of the key things you have to figure out is why are they not able to attain homeostasis? And the key thing then is why they're not able to make energy. So they come in and say, I'm tired, and then you know there's something happening with their ATP mechanisms. Here's a slide to illustrate some points and some concepts as we go through the material. So I put 3 different scenarios here, and I put 5 different types of clinical presentations. So traumatic brain injury, let's say viral infection, burn, organ disease, maybe it's lateral liver disease, alcoholic fatty liver, it could be anything, autoimmune disease, maybe it's RA. It doesn't really matter, but those are the main categories. Then I have 3 different scenarios, and here you can see in the middle, let's say like a person has average ATP production, compared to someone who has really, really healthy ATP production here. And then you have someone who has very low ATP production. So ATP being the fuel that your cells need to drive biochemical processes. So obviously, if you have a person on the other side of the spectrum here, where they have a brain injury, have an infection, or some kind of organic disease, their ability to recover, their resiliency to the condition is strongly related to the physiology of how much ATP they can make, because that's what they need in order to attain homeostasis. And because someone that has lots of ATP, for example, someone who has lots of healthy fuel going to their system, they eat really well, they exercise all the time, they have lots of mitochondrial biogenesis developed for things they do, their resilience is much, much better. So that's a really important thing to understand, is that outcomes, a general factor or variable in outcomes, is the body's ability to produce energy. And the body's ability to produce energy is what you need to attain homeostasis. And then here's a diagram that I made, relationship between a person's energy level and disease resilience. So physiologically, with people that make much, much more energy and more efficient bioenergetic pathways, they typically have a healthier brain, their ability to be active, they can recover quickly, they have decreased disease risk. You hear about the 90-year-old who's still skiing, who's still working, so very active. They have very healthy mitochondria. And then when you have a 20-year-old who can't get out of bed and can't function and can't do anything, they have very poor mitochondria. So what's the difference? What happened? There's variables and factors that change those expressions, right? So if someone goes on the other side of the spectrum and they have fatigue syndromes and pain syndromes and mood disorders or neurodegeneration and cancer and cardiovascular disease, there's lots of research that shows faulty bioenergetics are a key part of that. So when people come in and say, hey, I'm really tired, it's a really big deal. It means a lot. And this is the question for you. Where are you at? How is your energy level? Is your energy level improved over the years, or you have more energy now than you did before? And it can be different between physical energy versus cognitive energy. Are those different? So the more efficient you can make your bioenergetic systems, really the more you can accomplish, the more resilience you have for disease. So even though we'll be focusing on clinical aspects of this with patients, you really have a responsibility for yourself and for your family members when you see them tired and run down to really dig deeper, because those things can end up really increasing risk for neurodegenerative diseases, degenerative joint diseases, just general resiliency to different types of pathology and stressors. So let's go to some of the clinical phases of impaired bioenergetics. So here's a scenario. Here's a picture. Let's say a 34-year-old lady, never been able to recover from my car accident. I have fatigue as one of the chief complaints. So why isn't the patient able to recover? So maybe the extent of injury wasn't even as severe as other people you may have worked with or that are out there after some kind of trauma. But some people cannot recover. One of the key things you need to have for recovery is healthy bioenergetics. Or here's another person with fatigue, depressed all the time. There's an intimate relationship between the frequency of firing of your prefrontal cortex, limbic system, and your mood. So when brain energy levels go down, one of the immediate chief complaints is decreased mood, not ability wanting to do anything, dopamine levels go down, bioenergetics, neurotransmitter activity, they all go down. And one of the consequences of decreased mitochondrial function, decreased ATP in the brain is really depression. And we'll show you a bunch of research with that throughout the course. Here's another scenario. A person with fatigue. I'm tired all the time And when I exercise, my body hurts for days. And there's people, when we went to the diabetes course, we talked about the difference in mitochondrial function in diabetics and people that have obesity compared to normal population. They just don't work as well. We'll also talk about people that have what's called chronic fatigue syndromes, they call it, or fibromyalgia patients, where they actually have deficits in their mitochondrial function. Here's another scenario. I've been able to recover from my Epstein-Barr infection. They're chronically sick. They develop autoimmune diseases. We all see these types of patients in our practices. Or they cannot function in the morning. My muscles are always tight. They just don't feel right, but they're young. They don't know what's happening with them, and they have fatigue. Or a person who just is wiped out. And they're healthy. They should be healthy. They're young, tired, they're brain fog, their body hurts. They have a huge list of labs. They've been everywhere. They don't know what else to do. They haven't been diagnosed with the disease, and they're frustrated. So these are the faces of impaired bioenergetics. These are the types of cases that the information we're going to discuss in this course is really going to go into. Now, ultimately, when you look at bioenergetics, you're ultimately looking at mitochondrial function. So at the end of the day, when we look at all the different variables, there are some things that disrupt mitochondrial function and there's some things that activate it. And then people who are not producing energy may have a combination of both. They may be exposed to lots of things that disrupt their mitochondria, and they may not have enough variables in their diet and their lifestyle that are impacting activation of their mitochondria. And when this thing shifts, where there is a decreased potential to make ATP, this is when we see all types of clinical presentations. And ultimately, when you look at people that have fatigue, sometimes they have a medical condition that's causing it as part of the big picture, and sometimes they just have physiological mechanisms that aren't really disease, but they really impact how energies function. For example, medical conditions like anemia, hypothyroidism, or diabetes, or autoimmune disease, or pulmonary disease, or any kind of disease of the organs, they're all going to cause fatigue. But then we have conditions like just insomnia, or dysglycemia, or sedentary lifestyle, or just chronic inflammation, or multiple food sensitivities, or chemical sensitivities, or lots of oxidative stress that can also cause fatigue. And realistically, with many chronic patients, you have a kind of overlap with both those things. And that's what you have to navigate and work yourself through as you go through the process of trying to optimize their bioenergetics. Now, here's a list we're going to go through step by step in detail later on throughout the course. But I just put together on the left-hand side disruptive bioenergetic factors, things like toxins, chemicals, infections, hypercaloric diet, systemic inflammation, drug-induced mitochondrial injury, dietary protein inflammation, and the things that support the mitochondria. Healthy delivery of fuel, glucose, ketones, oxygens, antioxidants, mitochondrial metabolism, physical activity, cognitive activity, hormone activation, mitochondria, bioenergetic nutraceuticals, sleep impact on mitochondria, circadian rhythm impact on mitochondria, periods of restricted feeding. And I will tell you that before we go any further, this is not a nutraceutical game. You're not going to just put people on bags and bags of supplements and they're going to recover. As a matter of fact, most of the patients that you see in a real clinical scenario are coming in with bags full of supplements. What's happening is they're not getting the underlying physiological mechanisms identified and then doing strategies to address that. They're hoping they can supplement their way out of it. And with many of these bioenergetic issues, you cannot do that. You can always use it as an adjunct therapy to help you address the goals specific to what mechanisms you find. But it's not something you're just going to take some magic probiotic or some magic energy drink and everything's going to get better. It just does not happen.
If you're a licensed healthcare practitioner ready to evolve your functional medicine practice, explore over 300 hours of clinical training, masterclasses with leading functional medicine clinicians, and certification pathways. Or check out the Academy of Functional Nutrition and Lifestyle Medicine at afnlm.com. Whether you're on the path to certification as a functional nutritionist or simply want to optimize your own and your family's health, our skill-building approach builds real-world competence from the ground up. And lastly, if you're dealing with chronic health challenges, visit drknews.com for self-paced courses that help you understand and address fatigue, brain fog, autoimmune conditions, gut problems, and more using evidence-based approaches. The content on this podcast is for educational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. Always consult with your healthcare provider before making any changes to your health regimen. Thanks for listening, and don't forget to subscribe and share with someone who might benefit.